A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
The COVID-19 numbers are staggering, and experts say we're not even seeing the full impact of holiday gatherings yet. New cases are exploding across the country, and here in Western New York, we're seeing more hospitalizations and more deaths. The good news is that we're starting to see the light at the end of the tunnel. As we come to you, vaccines have received FDA approval. As many as 20 million Americans could soon be vaccinated by year's end. But this is only the beginning. It's going to take a massive effort to produce, distribute, store, and deliver doses to people across the country. Here to answer your questions surrounding the pandemic is Dr. Kenneth Snyder, Vice President of Physician Quality at Kaleida Health and a neurosurgeon at UB Neurosurgery. He is also an assistant professor of neurosurgery and radiology at UB Jacobs School of Medicine and Biomedical Sciences. And Dr. John Selleck, a professor at UB Jacobs School of Medicine and Biomedical Sciences. A leading expert in infectious diseases, Dr. John Selleck's work includes pandemic and bioterrorism planning activities. He sees patients at Kaleida, the VA health system, and at UB Student Health Services. And they join us for this edition of your Hometown Health Connection. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. The U.S. continues to suffer from a surge of COVID-19 with thousands of new cases each day. The numbers are also on the rise here in Western New York. We're seeing more people in the hospitals and more people in the ICU and more people losing their lives due to COVID. With Christmas and Hanukkah and New Year's Eve approaching, health officials are again warning against gathering with people who are not in your immediate household. Doctors, welcome. Thanks for joining us. We'll start with Dr. Selleck. We're seeing COVID-19 cases on the rise in all 50 states, but especially right now, right here in Western New York. Why do you think that is, and why are the numbers so high here?
Their numbers are actually higher in other parts of the country, but for New York, they're higher here. We've seen as everybody has moved indoors from a very nice summer and very good weather. Everybody is indoors now, and people have COVID fatigue. They're tired of wearing masks and they're tired of distancing. We saw recently that even with all of the pleas to not travel, that travel over the Thanksgiving holiday, more than 3 million people through the TSA, and it was only about 5% lower than last year. So we've had a lot of movement of people and mingling of people who are not staying within their bubbles and resulting in additional spread.
What can we do right now to get those numbers down?
We have to get back to the basics, and again, we're all absolutely tired of this. I haven't seen my grandkids in months. They're out of state, but we have to maintain the discipline, mask use, distancing, good hand hygiene, not mixing our bubbles, going out with other people. It's very, very difficult. We did Zoom Thanksgiving, and the Christmas dinner that I have for my infection control nurses, we did by Zoom, and that's just the way it's going to have to be for a while. And unless we get back to that kind of discipline, we're going to continue to see this spread.
Dr. Snyder, what is the biggest difference between the initial wave of COVID-19 cases that we're seeing from the spring versus what we're seeing right now?
Yeah, actually, we have a larger wave of positivity now than we did in the first wave. We have learned a great deal about this disease in the 9 months to 1 year, but still have a lot more to learn. Earlier on, we were seeing a little bit of younger population coming in earlier on. That's now leveling back out to a similar age group, but because we understand a little bit more about this disease and are trying to preempt treatments much earlier on in the phases of the disease, the mortality rates are much, much lower. What was happening with the initial wave was our ICUs were filling up with very, very sick patients. What's happening now is our medical surgical floors are filling up with sick patients. So less ICU, but as more and more people come in and require hospitalization, that can start to shift and change. That's currently the status right now, but that doesn't necessarily predict that it will stay this way for the future.
Right. We're seeing more people now in the hospitals, and the death toll as well keeps rising. And this is putting a huge burden on our healthcare workers who are risking their own lives and that of their families. Can you tell me, what does that look like in the hospital right now?
Dr. Selleck, I'll start and then please comment. But the clinical teams are tired. The clinical teams are strained. People understand their mission, and this is what is meaningful work to us and gets us up every day. I was just mentioning to Dr. Selleck that there's a colleague of ours in town, Dr. Lucan, that heads a residency program for general surgery, and he called all of the neighboring hospitals and said, I'm here on standby with my team if one of your teams need a break. It's gestures like that that keep us going. We are only going to get through this together, lock and step together, and supporting one another together.
Absolutely. What else are you doing to keep morale up? It sounds like such a difficult time.
Dr. Selleck, go ahead and then I'll comment.
Yeah, no, I think Dr. Snyder is correct. It's, we all go into medicine because we, really want to do things to take care of patients and make life better for everyone. In the normal times, we're all very busy, but we have breaks, and we don't have, since the early part of March this year, this has been absolutely nonstop. We had a little bit of a, it dialed down a little bit over the summer, but this has basically been nonstop. And especially early on, and as Dr. Snyder said, we've been fortunate that mortality rates have gone from about 30 or 35% to about 10%. Hopefully will stay that way. But it's still, this has been a 7-day a week operation. And I think especially for the people on the floor, the nurses and the real frontline caregivers, when you're dealing with this intensity of illness and the kind of mortality rates that we were seeing earlier in the year, I don't care how tough you are. This just grinds you right down, and that's the point that we're at now. That taking care of ourselves has become almost as an important an intervention as taking care of our patients.
The spectrum of who's affected really is everyone, from the administrative teams that have been on call 24/7 trying to coordinate care throughout the region or with the state, the nursing teams that are strained, and where we used to be able to pull nurses in potentially from other areas around the country. Right now, every system is seeing the same strain. The respiratory teams, the dietary, anyone that's in and out of the rooms helping care for these COVID patients are strained, because they're not only worried about themselves, they're worried about bringing it home to their families and what might be down the road if they get sick. The healthcare system serves as the test bed for what all other businesses and other places can look to. What I mean by that is we don't shut down. And so when we implement measures of protection, masking, eye protection, and others, we're at half of the community prevalence, yet we're seeing all of these sick patients every single day. That same test bed will be our vaccination programs. We are going to be the testing sites for trialing these, seeing how things roll out. And I think that's a good thing. We need that level of relief. We also implement as many wellness initiatives as we can. We have counselors available 24/7, not just from the state resources, but literally internal resources. And we need to just check on each other. We ask when people check on 2 people each day, not just a pulse check of yourself, but get to 2 others just to ask them that question. Because without the physical contact that we always have, we're still as social distance as we can be at work. It's difficult to not have that connection and that touch. And so whether it's virtual or not, we just constantly propagate that through our system.
Doctors, if I can get both of your thoughts on this, what can the average person do to help healthcare providers right now?
The community has stepped up in so many incredible ways. Early on, many businesses and just community people were dropping off PPE and things to help us. That level of encouragement is so inspiring for us. Doing their part to help reduce spread in the community is what we need. And Dr. Selleck can probably speak best to that.
Yeah, I think that that's really the key. I agree with Dr. Snyder that people dropping off food and gift certificates and all of this stuff is absolutely wonderful. The thing to do now is please don't get sick. Do everything you can to prevent additional infections, because the fewer infections we have, then that's better for the community in general, and it's also much better for healthcare workers, again, for the things that we talked about, not being consistently overwhelmed. And I think that we really do understand when we see that people have to close their businesses down, or restaurants can't get open. We really do understand. We are very sympathetic to the fact that you're trying to make your living and do your life, but then you have to look at the other side of that, is that these are the situations that propagate the infection, that allow for the spread of the infection. So the more that the community can do to decrease the number of infections, that's the biggest gift that you can give us.
Dr. Selleck, can you break down for us how testing works and how reliable is it? Sometimes there's a false sense of security and on some of these tests.
Yeah, this is very complicated. In fact, I just did 2 days ago, I did at Citywide Infectious Disease Conference, I reviewed all of the testing because it is very complicated. Without getting into all the gory details of the different types of tests, I think the thing that's most important is that people have to realize this is not like testing for strep throat. So if I test you today and I do the test the right way and I use one of the good PCR tests and it comes back negative, what I can tell you is at the moment that I put that swab into your nose or your throat, that you are negative at that point. That doesn't say what it's going to be in a day or 2 days or 3 days. So one of the questions that I got a lot before Thanksgiving, and I'm now, as of this morning, starting to get it again before Christmas, I want to go visit someone. Can I just get a test and then I know I'm good? Well, you're not good. Again, it just means at that moment that you're negative, but it doesn't say where you are. So again, it gets back to that discipline of not spreading from one person to another. And again, it's miserable. We're going to miss having big Christmas again this year, but this is the way it's going to have to be.
These are difficult times for all of us, but help is on the horizon. When we come back, more of your coronavirus questions answered with Dr. Kenneth Snyder, Callida's VP of Physician Quality, and Dr. John Selleck, a Callida leading epidemiologist.
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com.
Welcome back to your Hometown Health Connection. I'm Samantha Latshaw. With me is Dr. Kenneth Snyder, Callida's VP of Physician Quality, and Dr. John Selleck, a Callida leading epidemiologist. We're answering your questions surrounding the pandemic. Dr. Snyder, the vaccines will start to be distributed in the coming weeks, but we know it will take several months before most of the population is vaccinated. What do you think that would look like here in Western New York, and who will get vaccinated first, and when can we expect this to happen?
Sure. The state, in working with the federal government, kind of has a very rigid and strategic plan around this, and will follow those regulations. And in the first tier, what we know of is that healthcare workers in the highest risk areas and nursing home employees and nursing home patients will be getting that vaccine, depending on how much volume we're able to get here in Western New York. were ready and waiting and have been well in the planning phases for implementation of these. Regardless of which vaccine shows up, we have the storage capacity and the ability to track and administer it. We work together as a consortium of hospitals within Erie County with Dr. Gail Burstein to, again, kind of coordinate, discuss, work out the kinks amongst the teams. Again, as I had mentioned, there's a great deal of skepticism around the vaccine. And a lot of it, I think, comes from misinformation, but a lot of it also is we need to meet the community where their questions are. This isn't about just showing them the data to convince them to get it. It's about really understanding the questions that they have around it and addressing those in a meaningful way. And I think as the healthcare workers continue to get this and we learn more about it in time, it will continue to build and instill confidence in the vaccines.
Yeah. Dr. Snyder, you actually just teed up my next question. Dr. Selleck, can you talk about the fear people have of the vaccine? 40% of people say they won't get one. What do you think that we have to do to educate these people regarding the safety of the vaccine?
I've spent a good chunk of my career trying to get people to get immunized against a variety of diseases, and this is one more step along the way here. As Dr. Snyder mentions, it really involves a different level of engagement, because I can get up and put together a set of slides and show you the scientific evidence where all of these things, all of these vaccines, all of the things that we try to intervene with work. But convincing someone at that one-to-one level is important, and I think it's going to be critically important for primary care docs and medical societies and everyone to have a consistent message. I always use the example several years ago when we were having one of the measles surges. Was one of the vice presidents from the American Academy of Pediatrics was on network TV, and she didn't go through a whole bunch of details about the science of the vaccine. She says, I'm a mother, I'm a pediatrician, my kids are immunized, my patients are immunized, you need to do the same thing. And I think that's a very strong message, as opposed to me showing you some statistics on how it works. But the vaccines, the information we have, and obviously this has been a much faster time frame than we have ever seen with any vaccine anywhere in the world, let alone just for us in the US, but the efficacy looks good. I just snuck a peek at my iPhone to see if the FDA has said anything yet, and as of a minute ago, they haven't, but I think we're all expecting that by the spring, we're probably gonna have several very high quality, very efficacious, very safe vaccines that will help us get back towards normal.
Once someone gets vaccinated, do I still have to wear a mask and continue to practice ongoing safety guidelines? Dr. Snyder, I'd love to hear from you, please.
Yeah, it's going to take a great deal of time for our entire communities to build up the ability to stop the spread of this virus. So if we think of the virus looking for people that haven't built up their own internal immunity, or maybe more importantly, we could talk about what happens when someone does get infected. Every part of this conversation is a relative risk conversation. Even though our mortality and death rates are going down with this virus, you don't want this virus. If you get sick from it, it can have significant long-lasting consequences. About 80% that get this virus don't need any health care. They're either asymptomatic or very mild, but about 20% really need to seek care. And of that 20%, maybe 5 or 10% come into the hospital sick. And just because they survive and we're learning how to treat it earlier on doesn't mean that they don't have consequences for long times, 6 months or sometimes even more. There's more scarring than we'd expect, and people can still have very significant lingering symptoms. So when they see the virus, though, regardless, our bodies have billions of years of an innate system in it to learn how to fight it. And we trigger both a B cell and a T cell response, and those are important. The B cells make antibodies that are like sharpshooters that are able to trigger this virus and actually stop it from infecting our cells or identify the cells that are infected and help those get killed. The T cells remember it. And so even if our antibodies drop down again, if the T cells remember what they've seen, they can trigger an antibody response again within a day. And so that's how our natural body would fight this. What we've done with vaccines is safely trigger the body to elicit the same B and T cell immune response without ever being infected with the virus. So when we talk about the symptoms that people can get from vaccination, it's the symptoms of your body's immune response mounting those soldiers that are ready to combat it if it needs to. The fever, the pain at the site, the headache, the malaise, the chills, the muscle aches. That's not you got infected. That's I'm building up an army in case I ever see this virus. And what we need is the community to be at about 80% of having an immune response so that the virus can't jump and find another individual to spread it and continue to spread it. Again, if we're thinking of dry grass and a fire, we're pouring a hose over as much of the land as we can so that fire has nowhere to jump to.
Now, these vaccines, both of them were made with amazing technology. Do both vaccines, the Pfizer and the Moderna vaccine, they work the same in your body? And will we be able to get to choose which one we want?
They're basically the same technology, strands of ribonucleic acid, RNA. Right now, I think one of the things Dr. Snyder said is critically important, and that's the risk-benefit ratio. So we're not going to target, as we do with most of our vaccines, we're not going to target young people early on with this vaccine. We are going to target people at the point where they're at the highest risk of a bad outcome, which is why we're going for people in nursing homes, the staff in nursing homes, hospital staff. Depending on how this develops over the last several months, you may eventually get some choice in vaccine, but early on, there's such a relatively small number of doses. Pfizer, I think they've got something like 6 million doses. There are 328 million people in the United States. So obviously we're not going to be able to, and it's a 2-dose regimen. So we're not going to be able to get everyone early. So I think early on, you're going to have to get, and again, hopefully you're doing that risk benefit analysis and you say, I need this vaccine, and you're going to get whichever one is going to be available. And then maybe come the spring, there will be some options with that.
What's very exciting in this new data, and again, I wouldn't be surprised if the Nobel Prize comes out of this. The work on these mRNA vaccines have been taking place since SARS originated in 2001. These are 20 years in the making and the basic science behind them. Normally, the way vaccines are made is you take a virus and infect either cell line or a chicken egg, and you let the virus run rampant in these cell lines or in these incubated eggs. And at some point, you then kill off all the virus and then inject it. That's how typical viruses are made. What's amazing about this technology is we're using the code for just the spike, the part that's most antigenistic in our body, the thing that triggers the immune response, and that's all you get. And we're putting that directly in our bodies and allowing our bodies to be the machine that makes the response. You don't need to let the virus run rampant in something to make the supply of vaccine. And literally, it used to take like 1 egg's worth of vaccine of virus was what equaled 1 dose. So you can imagine how much work would go into building those vaccines. We're now using our own bodies as the incubator in the machines without needing any of that other technology. It really is revolutionary and incredible. And again, I will say, I want the highest risk people to get it. But I will be, I see acute neurosurgical patients, many with COVID, many with stroke. When it's my turn, I will be getting it because it will give me a significant peace of mind knowing that my immune response is primed and ready. What we need to be careful about is you can still get sick. You can still be infective, but the time frame that you should be infective should be much shorter. There's a nuance in the AstraZeneca routine that's different than the Pfizer and the Moderna. The Pfizer and the Moderna studies only looked for symptomatic people. They only tested people when they were symptomatic with COVID. The AstraZeneca trial is testing everybody. So it's a really interesting trial because we're going to learn if the vaccine actually shuts the virus down completely. And so we're excited to collect that news when those reports come out.
Doctors, we have a few months ahead of us before we get the vaccine. What are a few words of wisdom you can share with us as we push through the holidays and beyond?
Again, we have to go back to the basics, not mingling with other people, maintaining our social or physical distance, wearing masks when you're not with your very own indoors, with your very own household, and good hand hygiene. And then once the vaccine becomes available, get it. I mean, we're all going to get it. I'm not going to elbow my way ahead of the folks who work in the ER or the ICU, but when my turn comes, I'm going to get it as well. You know, these are the things that we can all do, and the more of this we do, the sooner we get back to something that looks like normalcy.
We need to educate people, not tell people how to behave. We need to understand that everyone has a set of priorities that are critical. If someone's father or grandfather's 99 or 100, and this may be their last Christmas, we understand that. And how do you then do the best you can to minimize risk around those scenarios? I want to thank you, Samantha. I want to thank Annette Pinder and Buffalo Healthy Living. We need to have a lot more engagement with this community to answer their questions on these vaccines and what we need to do day by day. I think we have to understand that people that don't look like they're sick are who could be spreading it. We have to treat every single person as if they're potentially positive and understand that as we're interacting them and making our decisions.
Having you both here tonight is extremely helpful for our community. Both Dr. Kenneth Snyder and Dr. John Selleck, thank you so much for your time.
Thank you for having us.
Happy holidays, everyone. And Samantha, thank you.
And be safe.
While promising COVID-19 vaccines are just a few months away from widespread distribution, our experts warn there is still a long winter ahead. Health officials say we need to continue to wear a mask and avoid large indoor gatherings, no matter how difficult it may be for some of us. Keeping up with safety guidelines is still vital. The vaccine is the light at the end of the tunnel, but it will not stop the current surge. Let's dig down and do more. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living magazine and its sponsors.